Hello, everybody. Welcome to this Mission Cure webinar. My name is Megan Golden. I'm the CEO of Mission Cure, and I'm here with my colleagues, Shruti Mirashankar, Olivia Zaiden, the rest of the Mission Cure team, including Linda Martin, I believe. I welcome you to this webinar on stress and pancreatitis. We have almost 400 people registered. And so just starting with a little background on Mission Cure. I co-founded Mission Cure with my brother Eric and Linda Martin in late 2017. Both Eric and Linda's daughter Amy had been diagnosed with chronic pancreatitis after many years of pain and misdiagnosis. And doctors said there was no treatment or cure, and the only thing they could do was palliative care to manage the pain. So we launched Mission Cure to change that. We're different from the typical disease foundation. We started by surveying patients to see what outcomes are most important to them. Pain was one of them. And then with help from leading pancreas experts, we developed a strategy to improve those outcomes by developing therapies. And we are making good progress. There are brand new treatments for autoimmune pancreatitis and pancreatitis caused by extremely high triglycerides just on the market now. 4 companies are actively developing therapies for other types of pancreatitis. And 3 potential treatments are being tested in clinical trials in academic hospitals. Check our website to see if one of these trials might be right for you. This webinar is part of our patient education program, which is supported by AbbVie, Amgen, and Ionis. We really appreciate their support. So I'm excited to have Dr. Amy Serin speak with us today. I met Amy at the American Pancreatic Association conference in December. And so Mission Cure goes to pancreas conferences regularly to meet with doctors and researchers and biotech companies. There's usually not that many patients and families there. Well, this time we sat down at the breakfast table, and there was a woman at the table wearing a t-shirt that said, "I have 2 sons with PRSS1. And it was Amy Serin, and I knew immediately that she was one of us. I learned after talking to her that in addition to being the mom of 2 sons with hereditary pancreatitis, Dr. Serin is a famous neuropsychologist, and that is a psychologist specializing in the brain and its impact on behavior. Hope I got that right, Amy. She treats famous athletes and top CEOs, and she is the outside health expert for the exclusive wellness resort Canyon Ranch, which uses the approaches she's going to tell us about today. One of her specialties is stress, and she agreed to come share both her professional experience and her personal experience with our community. So now I want to introduce Shruti Mirashankar, who leads our patient education program, to kick us off and go over our agenda for the day. Shruti?
Thank you, Megan. And to our audience, thank you for taking the time to be with us today, live or on replay. Today's session hits close to home for many in our community. We're talking about stress. You'll hear from Dr. Amy Serin, who will walk us through the science of stress, what it really is, how it affects our bodies, and why understanding its impact is important when living with pancreatitis. We'll also hear from Patty Codaro, a patient with chronic pancreatitis, about her personal experience navigating stress and working with Dr. Serin. A gentle reminder that this session, including the Q&A, is for educational purposes. Please consult a licensed mental health professional for support tailored to your individual needs. Just note that the discussion with our expert will remain general and is not based on a doctor-patient relationship. We planned the session during National Stress Awareness Month because stress is a very real part of life with pancreatitis for both patients and caregivers. And stress is not limited to emotions. Stress can affect the nervous system, immune function, pain levels, and even the body's ability to heal. Today, we aim to deepen understanding of what stress is and how it shows up in the body, recognize how stress may influence pancreatitis symptoms and pain, and share science-backed strategies to manage stress and improve quality of life. Dr. Serin will introduce powerful approaches that go beyond talk therapy, covering tools designed to support the nervous system and activities to reduce and potentially prevent chronic stress. These are especially relevant for people managing long-term health challenges. She will highlight treatment options and tools, some based in neuroscience and others rooted in practical habit change that show promise in helping people regulate stress. We recognize that what works can vary person to person, and not every option will be feasible for everyone. While we are not promoting any specific product or approach, the goal is to offer examples of how science and innovation are expanding access to practical options for self-care and well-being. The bigger goal today is to offer clear, credible information and open up the conversation around stress and chronic illness. Because recognizing and managing stress is essential to long-term health and not something we can overlook. Right, now I'm excited to introduce Dr. Amy Serin, a licensed and practicing neuropsychologist, researcher, and founder of Serin Centers. Dr. Serin is a pioneer in translating brain science into practical tools that people can use in daily life. She is the author of the book, The Stress Switch. Dr. Serin, we are eager to dive in. We are listening and ready to learn. Over to you.
Thank you so much, Trustworthy. I really appreciate it. I'm so happy to be here to share this really wonderful information with all of you. Really an honor. Thank you. I want to go through a little bit first of my background because, as Megan mentioned, I do have 2 sons with PRSS1 and chronic pancreatitis. And as I was starting my career as a neuropsychologist and an EMDR therapist, I realized that one of the tools in EMDR could be used to help my sons manage their stress outside of the office. And when my son was 7 and he was in Phoenix Children's Hospital, I gave him these old wired devices. They've evolved now to nice wireless forms, but I gave him the devices and I used them while I was in the hospital to help manage my stress. And we were in the room with another child who was aging out of the Phoenix Children's Hospital system, and he had to change his doctors and go to another whole hospital system. And he was very, very distressed. And this particular patient had sickle cell anemia, which is very painful as well. And I gave him the devices that are just vibration devices. They're non-invasive. And he looked at me and he said, "I do feel less stressed, but why is my pain gone?" And I looked at him and I said, "I don't know, but I will find out." And it was from that point on that I started researching the link between stress and pain and how the brain works, and realized that as a culture, and all of the global cultures really are misunderstanding what stress is in the brain. And if we have a better understanding, then what we can do is we can actually modulate stress in real time. And that has great implications for pain and for healing a lot of our body systems. So that's kind of how I got started in the culmination of what I'm going to talk to you about today. So I want you to forget what you think you know for a moment about stress, okay? Because usually people think of stress as this general kind of concept. "Oh, I'm stressed. I have stress because I have a medical condition or because I don't like my mother-in-law," or these things. But I want you to think about stress almost like your blood sugar regulations, right? It's your body's in the moment reaction to an external sensory trigger, a thought, or another internal signal. So it's really the millisecond by millisecond response to what your brain and body are absorbing and taking in and integrating and doing in every given moment. And a very important point here is that it can be unconscious or conscious. So you can actually, your body can be in a state of stress and you may or may not be aware of it. And there's actually a key network in your brain that I'll talk about that is responsible for that. And so your stress, I want you to think of it as something that fluctuates in real time, and it's actually your body's reaction to something, not something outside of you. It's a response. Okay. So most of the time we think of stress as the general thing, and the management, we talk about stress management or coping with stress. And our approaches are really obsessed with chemicals and consciousness. Meaning, I think that I need to change my stress with a drug or something that's going to lower my stress, or I need to think my stress down. I need to do something with my thoughts or with my reasoning to get that stress down. And there's issues with this because the medications that artificially induce calm don't change your patterns. They also can be addictive and have side effects. And the problem with trying to think your way out of stress is that the very networks that control your thoughts are actually shut down when you're in states of stress. So you cannot access those And you've all probably had the experience of, I know I shouldn't be upset about this, but I am, and you feel it in your body and your stomach hurts or your breathing is impaired, and you just trying to think it down and it's not working. You're actually biologically wired to have that not work. But don't worry, I will tell you, I will tell you why and what to do instead. So your brain is not just chemical. We always think about neurotransmitters and chemicals. Your brain is electrochemical, and we want to focus on how the brain fires and wires in real time, sending signals and doing things and modulating every single process in your body. And the sensory networks are actually in control of this. There's actually a new article in Wired that just came out a few days ago where part of this salience network in your brain, in the thalamus, we used to think of it as a relay station. It's just absorbing information. It's not passive. It's not just absorbing. It's actually the great integrator. And the thalamus picks what you even get to pay attention to. So if you're at a picnic having a great time and an ant bites you on the leg, you may not even notice because the thalamus didn't bring that up to your consciousness. But if you're being very quiet, just sitting, not doing much, and an ant bites you, you'll perceive that pain right away because of how the brain is integrating that information. This is very important because that means we can add sensory inputs in real time, no matter what's going on, and modulate that system through the thalamus and the salience network. So that's very, very key. And again, you can't access your coping strategies when you're very stressed out. And when you're very stressed out, your pain is going to be higher because you're going to be paying attention to that more and it's going to be worse. The other thing about when you're stressed is that all of your major body systems are affected. So it behooves us to really pay attention to this. And what I don't love is you'll go and get all these very specific recommendations from your doctors and everything. And then what's the recommendation about stress? Manage your stress. Manage your stress. Manage your stress. Well, what does that even mean? And so I'm so glad that we're here today talking about this. All right. So I want you to think of having a stress switch inside. And there's a scale from 0 to 10. Okay, 0 is that you're very calm and focused, present, you can connect with people, you can feel joy, you feel, very, very calm. There's nothing distracting you inside of your mind and you're feeling good and there's no disturbing body sensations. As we work up on this stress switch scale that again is fluctuating in real time, we get up to 1 to 3. That's when you can still think about your thoughts. You're not really feeling anything distressing in your body. Higher order thinking is on, but there may be a little bit of something. You're not completely zen in that moment. Then when you get up to 4 or 6, now you're at the point where you're going to start having disturbing body sensations. Maybe you feel a little bit something in your gut or your chest or headaches. Those are the 3 most common things. And in this state, the things that you've been taught can still work. You can use breathing to bring your stress switch down. You can think positively or use strategies to bring it down to about a 3. But once you get into 7 or 8, this is when all things that are not essential for survival start to shut down. This is when you're going into fight or flight. Your thoughts are going to be negative and rigid. You're not going to be able to reason well. For executive functions, maybe irritable, and then all the way up into 9 or 10, fight, flight, freeze, tantrums, reactionary panic, survival mode. And so this is really important to be able to start gauging where you are on this switch at any given moment, right? Because it not only impacts your health and your well-being, but it impacts your relationships. I don't try to have conversations with my partner if I'm at a 7 or an 8, because if he's not stressed, then it will bring my stress switch down. But if I'm stressed and then he's stressed, right? It doesn't really go very well. And so we want to understand that depending on where we are on our stress scale in every given moment, dictates how we show up in the world and with others, and also how we feel inside. So we want to think of these modes of stress switch where you have a default mode. You all have maybe a stressed out friend, or maybe you're the stressed out friend, right? Where your default mode is pretty high. You kind of run, you wake up in the morning, thoughts are racing, feeling anxious, those kinds of things, and have signs of chronic stress. That's when you have a high default mode. In other words, your normal stress switch is typically hovering at too high of a level to promote health. So the goal there is to bring that down and to have a low overall default stress switch mode. From that low default, things are going to trigger it. If we heard a fire alarm, for example, then we would all go into fight or flight before we know what was even going on. That's going to tick our stress switch up to a 7, 8, or 9. Then we figure out, oh, if it's a false alarm, okay, then it will go back to our default. So it's going to fluctuate based on that. It's also going to fluctuate based on the state. So the state of our brain dictates what happens with incoming information. So if I've got a default and then a trigger, and even if my default switch is kind of low, my default setting in my body is low, if I've had crummy sleep, if I didn't have breakfast that day, if something else stressful happened, that's going to actually maybe create a higher reactivity in that moment from a trigger than it would if I was well rested, if I had a healthy meal, if my general health behaviors are on point. So it really, really important to know that certain triggers can really trigger you worse if you're not in a state of health or if you're in a vulnerable state at that time, right? So you want to think of your default stress switch mode and getting that lower in general. And then once your stress switch gets high from a trigger, we want to lower that in real time. And those are a lot of the strategies I'm going to be talking about today. All right. So again, we already actually covered this on the last slide where we want to lower your default and then return to the baseline fast immediately after an acute stressor or spike. The one thing I want to say about this that's very important is doing that not only helps you in the moment, but it is preventative. So we can prevent things like phobias from setting in or things getting worse and worse and worse if we pattern interrupt a high stress switch based on a trigger. That thing will not be triggering you as much in the future. So it's very important to know that if we use these methods, we're not only just helping ourselves in the moment, but we're also changing how our brain's habit is in terms of how it responds to certain triggers. Next. All right, now with pancreatitis, it's tough, right? Because most people's coping strategies are outstripped by too much stress. And these are some of the things that you may notice when you're feeling stressed or when you're in pain from pancreatitis. And what happens is having a chronic medical condition can create a higher default stress switch mode. That equals more pain. And then we call it the doom loop, starts going. And you get more and more of the above until the cycle is disrupted. Okay, so we really want to disrupt this cycle. All right. Recognizing the signs of stress in a short-term stress situation where your stress switch is high, you may notice the things on the left. And I wanted to highlight stomach pain because stomach pain is one of the most frequent ways that people react physiologically to stress. And that can be modulated in real time. And when you have a medical condition like pancreatitis, where pain is often used to make medical decisions, it's very, very important to know that sometimes that's a result of stress and not necessarily an internal medical issue flaring up. And modulating that and trying to treat it via these pathways first may be really helpful in lowering pain. And even if the pain does have a medical cause, when we interrupt some of the brain's processing cycles using non-invasive techniques, we can actually lower that pain in real time. Chronic stress gets into these things that are the acute symptoms, and they just become chronic. They become the brain's habit. Now, the brain is really great, and it works off heuristics, and it works off patterns, and it does so that not everything to you is new. This is how it learns. This is how it works. It makes generalizations. And the flip side of that, when you have a medical condition like pancreatitis, is that stress and pain become habits, and they need to be disrupted. And that is part of the good part of how your brain works. But unfortunately, if we're not doing the right things to counteract that and disrupt the doom loop of stress and pain and disease, then things get worse and worse. All right, so we're going to take a poll here. And for those of you who are live, you can take this. If you're watching this afterwards, it won't be available to you. But I'd like you to rate where you think your stress stage is right now in this moment. And that's the scale from 0 to 10. And then the second question is whether or not you think you are suffering from chronic stress and have symptoms of insomnia, irritable bowel syndrome, inflammation, adrenal issues, PTSD, anything like that. Okay, so, well, good news, only 6% of you are a 9 or a 10 right now. Most of you are actually hovering between either 1 and 3 and 4 and 6, about 70% of you. So So that's great. But the ones that are 7, 8, 9, or 10, you might need to watch this again, because when you're in that high of a stress state, what happens is, again, memory and learning are not essential for survival in fight or flight. So you may remember less of this information, and you may also filter it out a little bit differently. So for those of you who are very, very high, I'm sorry that you're suffering right now with that high of stress, but I am happy to see that most of you are actually at low levels right now. The other thing, though, is that 81% of you have actually said that you think you're suffering from chronic stress. That's distressingly high, and it breaks my heart to see that number, but it also makes me very happy that you're here today. So thank you for responding. So the impact on your medical health and your pancreatitis symptoms is really great. A lot of people don't think of stress in terms of the impact on your behavior and your body. So first, we know that chronic stress causes inflammation, right? It impacts every system in the body, including your GI tract. Actually, the parasympathetic nervous system is at the bottom of the stress switch scale, and they call it the rest and digest system, because when it's not activated, when you're in sympathetic fight or flight, you can't rest, sleep, right? You also can't digest your food. It impacts this greatly, and it weakens the brain's command and control center. This, in the moment of stress, your reward network is more powerful. And if you remember those old cartoons with the little angel and the devil on each side, and that one's trying to talk you into the bad stuff, and the angel's like, no, don't do it, right? Think of the devil as your reward system going, hey, eat the fast food, drink the alcohol, or you need to cope, take the marijuana before bed, or whatever it is, whatever the behaviors are, or go shopping when you don't have money. You are more likely to go into the damaging behaviors that make your pancreatitis likely to flare when you are stressed out. So not only do we want to lower stress to lower suffering and to lower pain, we want to really be mindful of when you're stressed, coping with that stress often includes a shutdown of your executive function system, reward network, that devil gets big and the angel gets small, and you're more likely to go into those behaviors. Also, we know stress makes physical pain worse. It impairs your memory, creates negativity, and it will block your ability to take positive action. So if you're in a doctor's appointment, you might forget key points, or you may not have the energy. You may feel too overwhelmed to follow up on what the doctor tells you to do, thus keeping that doom loop going. You might also feel overwhelmed, isolated, hopeless, and forgetful. So really, really want you to take away from this, though, it's not all doom and gloom, that there is a way out of this, but we have to do it the right way. Okay. Those 81% of you responding to the chronic pain question, what happens with chronic pain is it actually creates brain changes in pain networks. And this is really important to understand, because even if the medical cause gets treated, you can still have pain, because the brain relies on its patterns unless there's a disruption in the brain's patterns. And pain is in the brain. That's why anesthesia works, right? The brain is the signaling center for pain. So if we use anesthesia, you don't feel pain because of how this works. There's a condition called phantom pain, which is the feeling of pain without a physical cause. And it's typical in people who get amputated, but they still feel physical pain in a limb that is not attached to their body anymore. We can treat phantom limb pain with a therapy called EMDR. It's eye movement desensitization and reprocessing. And we also can get the brain out of its habits using that therapy, because oftentimes we will help ourselves medically with something, but the pain persists. And then we think that there's still a medical cause, but it's very important to understand that the pain that you feel and the medical cause of it are not a one-to-one correlation. Oftentimes you can have pain with no medical cause, or you can have less pain with the same medical issue going on if you're modulating stress. So we can lessen pain in real time, even during pancreatitis, and not with chemicals. And if we lower your stress during pain, it can reduce the pain to a manageable level. And then over time, the brain can generate lower levels of pain as its habit. I was surprised, being a mom with sons with pancreatitis, I don't know the outcomes of other people with this, but using these tools with my kids, they've never been on opioids. But early on, we disrupted this cycle, and I think it's led to much better outcomes for them. Got a quick poll, and then we're going to get into the solutions for you. So what advice have you been given to lower your stress when you notice it happening? Maybe notice that a lot of these things, kind of assuming that we're looking at stress as something that's outside of you or that you will need to escape or distract yourself from. But the thing about distractors is you distract yourself from it, and then when you think about it again or it gets triggered again, it's in the same place. So we need true pattern interrupts that change it. Okay, so 88% of you, the top answer was breathing exercises, and those are great. And what I'd love for you to do if you've been taught those is to know that when you try to breathe, if you're at about a 6 or lower on your stress switch scale, those will work and those are great. But if you're higher than a 6, they won't work. So we need to get your stress down to lower than a 6 before those breathing exercises can kick in. 61% of you said medication and 68% of you said physical activity or exercise. So that's wonderful. Okay, so we've got powerful tools that go beyond talk therapy. The first is when you're doing therapy, you want therapy to be high impact, okay? And talk therapy is great, except cars from the 1980s were great too, but there have been technological innovations since then, and there's better things than just some of the traditional methods that you keep hearing about over and over again. The first is trauma-focused cognitive behavioral therapy. It's very, very specific on trauma-focused. And even though having a chronic medical condition is traumatic, a series of traumas actually, it really focuses that and there's better outcomes. Also, eye movement desensitization and reprocessing, that's one of the top trauma treatments, but we also can use it to desensitize pain. And the tool I'll tell you that I derived from EMDR actually should lower pain in real time. And those are called the bilateral stimulation or BLS tabs. And you can use those outside therapy sessions. Therapists were using those for like over 35 years in EMDR sessions. And I actually invented the first wireless devices. But since then, there have been better, more technologically advanced devices now that I'll tell you about in a moment. If you are in a chronic pain situation and your brain has chronic habits, sometimes neurofeedback can help. That is actual non-invasive brain training. It does require a lot of sessions in an office with a practitioner. And then now there's a lot of consumer products, some great, some not so great, that can do neurostimulation, like near infrared headsets and things like that. And that can really alter and improve brain functioning in real time. And what I'm talking to you about today, all of these things, there's obviously more, but all of these things are non-invasive and they're very powerful. So I've hand selected the ones to really focus on today to talk about. Next. Okay, I'm going to skip this slide because we already covered it. And then we'll talk about these bilateral stimulation tabs. So these tabs have been shown to reduce stress by 62% in 30 seconds. So if you've got, a 7, if you're a 7 on a stress switch scale, it can go down to a 3 or a 4 in about 30 seconds. And at the same time, lower 50% of physical pain associated with stress in 30 seconds. And this is actually research that I published with a sample size of over 1,000 people. It's a very reliable effect. And again, it has to do with how that brain is processing stress. The relay station of the sensory network, when it gets these calming, they're called bilateral vibrations. That's all they are, is vibrations. They're not electric shocks or anything like that. Actually downgrades the stress response. And also you can use them if you're having a hard time sleeping. You can use them when you're in pain. And this is the most cost-effective, portable, easy solution. And I actually developed the first wireless because I was consulting with a group of ex-military in Africa, and they wanted us to cure and prevent PTSD post-Ebola. And this was the best thing that I could find to lower stress so much that we could actually eradicate and prevent PTSD. So that's where the wireless versions came from. And the cool thing about these is that they actually create a pattern interrupt in the brain and actually disrupt the cycle. So if you get triggered by something and it causes stress, that trigger doesn't keep triggering you. It actually interrupts that. If you distract yourself with something that brings down your stress slowly, you do not get a pattern interrupt. So that very fast effect is what disrupts that brain's pattern. And I'll get a lot of questions about vagus nerve stimulators and things like that, because those are the hot new thing. But in my experience, the vagus nerve, it will lower your stress, but it does so more slowly. And you don't necessarily get that pattern interrupt. They tend to be a little more expensive than these devices. Also want to talk about general healthy habits, right? I know you've heard these, but I'm going to put a little twist on it, okay? Because you've heard about sleep, and some of you may have low light settings on your phones, and that's great. But the principle of the light is that all blue light is going to disrupt your sleep. Blue light is part of the light spectrum. So if it's yellow, it actually has blue light in it. You can wear amber colored glasses or use amber coated lights, and that will actually block out all of the blue light, and it will help your melatonin get produced faster. And melatonin is a master hormone that unlocks all these other processes. So the cheapest hack for better sleep and for regulation of your metabolism, and there's stunning research on anxiety and depression in this, is to just put amber colored glasses on that block out a huge percentage of the blue light a few hours before you go to bed at night, and don't take them off. And that's a hack. And then you don't have to worry about your lights, because just dimming those screens isn't going to help. Your light bulbs and your overhead lighting, unfortunately, is disrupting your circadian rhythm. And then as far as exercise, people say exercise, but the research shows 150 minutes of that, or moderate, or 75 minutes of high is the recommendation. And we know too, physical activity is protective in preventing anxiety disorders like PTSD. So for those of you who are in chronic stress mode and things like that, we know that exercise is as effective as antidepressants in lowering anxiety and helping with depression and things like that. We also know it's incredibly regulating to your health. So if some of these things that I'm talking about are maybe out of reach financially, exercise is typically free. That's the first thing that I would go to, is looking at exercise, sleep. And then also when we turn to diet, there's great recommendations on the Mission Cure nutrition webinars and the toolkit for pediatric patients. But the one thing about good nutrition and healthy diet that I would say is to avoid the sugar spikes. When your blood sugar spikes, your brain sugar spikes, and it creates a whole host of issues. That the devil on your shoulder gets big, the angel gets smaller, you're more likely to be stressed out. So that's the one key takeaway in nutrition that maybe you haven't heard before. Okay, so here's our key takeaways. First of all, you have an automatic stress switch. It's controlled by your sensory network, not your conscious thoughts. Your goal is to lower your default stress switch and return to a low stress switch scale mode whenever you're triggered. Know that lowering stress often lowers physical pain. And if you're going to pick methods, there's always an opportunity cost of what you're choosing. And I know there's so much noise out there in what you can choose and what you can do. Please pick something that's effective, that has very high impact, like the tactile bilateral stimulation devices, the healthy behaviors that have a high impact, not just should I eat 4 ounces of banana or 5 ounces of banana, not getting so granular with certain things when there's larger behaviors that would have a higher impact. Look at cutting edge therapies and technology that have maybe evolved past the 1980s and some of the old methods that have been going on. And I think that could go a long way with helping you manage and deal with this condition. Together, I do believe that we're all stronger. I'm really honored to be a part of this community, and I think that we can transform hope into healing. So thank you so much for having me.
Amy, thank you so much. Outlining a set of resources on this slide that was shared by Dr. Serin, and these will be available on our website along with the webinar recording. I just want to honestly thank you, Dr. Serin, for breaking down the science of stress and helping us understand what's really going on in our bodies and brain. Your work, it reminds us that even in the face of chronic illness, we have ways to shift our response to stress. We're also grateful for your openness in sharing your personal connection to pancreatitis. And with dedicated moms like yourself and Linda, our co-founder, and determined siblings like Megan, our CEO and co-founder, I honestly feel real hope in what we can build together for the pancreatitis community. Now, we're going to hear from Patty Cordaro, a chronic pancreatitis patient based in Colorado. Patty is a retired sales team coach who, like many in our community, was caught off guard by a diagnosis of EPI pancreatitis and the chronic pain that followed. While she couldn't join us live today due to travel commitment, she was eager to connect with all of you and share her reflections and experience of working with Dr. Serin virtually, and took the time to record a video for us. Let's take a quick moment to hear her story.
Hello, everyone. My name is Patty Cordaro. I feel so honored to be here with all of you. I want to share with you my pancreatitis journey and then a little bit about working with Dr. Serin. I had an attack one night in September of 2022, and I threw up bile and had pain, and I found out that I had pancreatic insufficiency due to a stool test. And then a year later, I found out I could get a celiac plexus block, and through that, the endoscopy revealed that I had chronic pancreatitis with calcification and atrophy in my pancreas. I'm 62 years old, and it's completely changed my life, and the quality of my life has decreased, which has been extremely stressful, would be the word I would use now, emotional, physically, spiritually, in every single way. Some of the most difficult, if I were to say the most difficult, has been the lack of information about pancreatitis, and all the doctors that I've been to who really don't understand or didn't know. And I just thought I would have to get celiac plexus blocks for the rest of my life. You know, I've had to cancel trips, and sometimes I'd go to events and suffer through and just pretend I'm okay. Change my diet. Thank God I found Mission Cure about a year ago, and that has opened up and given me some hope, and I was referred to a doctor in Mass General. I'm still undergoing tests to figure out my specific case, but I, for the first time, have felt an understanding. And at the same time, I was referred to Dr. Serin, who has also been so amazing. I, for one, know, and I'm sure a lot of you do, that when I'm upset, my pain is worse. And so I try so many different ways to stay calm. You know, I do yoga almost every day. I acupuncture, meditation. You know, I'm doing all of these things. And even in retirement, which was about a year and a half ago, I had this feeling inside of me like, gosh, I'm not able to exhale. I couldn't figure out why I wasn't able to like exhale and have this different paradigm. Obviously, I was in pancreatitis pain. And I met Dr. Serin. What a game changer in terms of her teaching me about stress and of the whole brain chemistry and the neuroscience behind it, and the sympathetic and parasympathetic parts of the brain. Somehow internally, I was still clutching. I did grow up in a difficult family life, and I'm recovering alcoholic. I'm 20 years sober, praise God. There's been a lot of challenging things. Dr. Serin has taught me to have a new relationship with the word struggle. I always think I have to struggle through things, even like struggle through the pancreatitis and struggle to get calm. As crazy as that sounds, I heard of EMDR. I've even did it a few times, but when I first started using it for pain and for my frustration around the lack of care or understanding, you know, this isn't a judgment against doctors anywhere. It's the way it is with rare diseases, I suppose. But I have learned how to reprogram and go inward. I've done a lot of talk therapy in my life, and you know, it only kind of got so far. It's almost like it stops at my head but doesn't go into my body. And Dr. Serin talks about the bottom-up approach, which is feeling and deep breathing, and with the bilateral stimulation, just, I mean, I remember one session where I was working through how upset I was around lack of care, and 10 minutes later, I couldn't muster up the frustration again. It's going to take some time to learn and practice being calm in my body and unclenching. Even the awareness has made a difference. I highly recommend bilateral stimulation from any practitioner. Dr. Serin's a master at really challenging the struggle and just really understanding how stress affects pancreatitis. I'm forever grateful to have met her. I have more hope now than I ever have. I wish that for all of you, and continuing to have hope and never giving up the fight for this. There I go, the fight for this. I'm just going to stay calm and continue in my learning and my practice. And I sense blessings to all of you. Thank you.
Thank you so much, Patty. Thank you for your willingness and enthusiasm in sharing your story and what's helped you. We wish you the very best. And right now, it's time for Q&A. All right, folks, let's get to those questions. Megan, over to you.
Yes, great. Thank you to Patty and to Amy for sharing with us. We've got a lot of questions and some submitted in advance. Why don't we start with some specific ones? Somebody that I've met before asked, how do you get your hands on these BLS devices? And another person asked, are the BLS equivalent to tapping?
Okay. So I think there's going to be a link in the chat on how to get them. They are shipping within the US. I don't know, for those of you who are in other countries, I'm not sure where they can ship. Unfortunately, it's not the same as tapping. So when you tap yourself, your cerebellum in your brain anticipates that movement. And so the response from tapping, or there's stimulation devices that actually have kind of like a hard tap. I've tested those on EEGs, and which is an electroencephalogram. It's how your brain's responding in real time. And they don't have the same effect. And tapping yourself sometimes can be better than trying to think about things. If you're at a 7 or an 8 or a 9 and a 10 and you don't have devices, tapping is better a lot of times than thinking, but it does not have nearly as powerful effect as the vibrations of the bilateral stimulation devices. And I did all the research and the testing on that years ago. Yeah.
And just for the people who aren't familiar, what is tapping?
Tapping is, there's some people will tap like this, cross their hands. It's called the butterfly hug. It's a method from EMDR, and alternate. And then some people with acupressure points and things will do something called like a thalamus tap. And then some people will tap on or press on the vagus nerve, and it just doesn't have quite the same effect. But when you're in a stressful situation, again, some of those things can be better than thinking, right? Just like going outside and doing something physical is better than just staying in, an obsessive loop of thinking, right? But you're not getting that pattern interrupt, and you're not getting the same effects on the brain's response to the stressor.
And would any of the electrical devices be covered by insurance?
So they are on the website. They are HSA and FSA eligible, and people can go on the link that we gave. There's a form that they can fill out if they have HSA or FSA, and they can use it for that. But right now, there's not a specific code that's reimbursable by insurance.
One person asked if they can take CBD gummies to help with stress. You can comment if you want, but there is a short video on our website about about cannabis and pancreatitis pain.
Yeah, I think that the thing that, just as a general principle, my bias is to go the least invasive and things that don't have negative side effects. And again, with the brain being electro and chemical, I am more interested in not invading the body with chemicals and taxing some of the systems if we can avoid it. Thank God for some drugs when we need them, and all of those things, and all the medical advances and it's wonderful. But when we have a choice, for example, if someone's depressed and we have a choice between starting to take Prozac or exercising, because we're not exercising, and we can get a similar effect with positive effects versus possible side effects, there's a choice there. And so I tend to lean more towards going with things that are non-invasive. And so things like CBD for stress, it can absolutely lower stress in real time. However, there's some side effects for it that if I can lower it another way, I might go for that as a different choice.
How do you not let stress and anxiety overhaul you so much that you're getting so overwhelmed and making yourself triggered and causing a flare?
So causing your own flare of stress is typically the absence of being able to disrupt your stress switch in real time. And it's typically, if that's kind of like if somebody's obsessing about something and trying to just think, or using the wrong strategies, or being so far into fight or flight that they can't think clearly. And we have to kind of wait for their brain and body to come down. And instead of coming down from it, we exacerbate it and make it worse. Usually thinking is the culprit there. Some people go from 0 to 10 on stress switch mode very quickly, but some people kind of can work themselves up. And maybe some of you have had this experience where, venting can be helpful sometimes, but sometimes you can vent yourself. You can talk to your friend and be upset about something and work yourself up into more frustration. And so really just paying attention to what in real time you're doing to get that stress switch lowered, instead of perpetuating that cycle for yourself. And thoughts and getting yourself worked up are typically the culprit, unless you're already at a 10. When you're at a 10, you got to get yourself out of fight or flight, and often thinking about how to get yourself out of fight or flight isn't even available to you. So we want to prevent the 10s as much as possible.
Another question: is the parent of a 6-year-old child with PRSS1, pancreatitis. I would love to hear how you help your sons manage pain and stress. For instance, at that age, for instance, if one of your sons said, "My stomach hurts," how do you respond to that?
Well, if he said my stomach hurt, I would actually use the tabs. And then usually we could get it from a 7 to like a 3. And in fact, one of my sons, I knew he had PRSS1 when he was 7. My other son, we didn't know until last year. And he had stomach pain every once in a while, but it was like the first day of school. And I thought, oh, it's just stress. So I gave him the tabs and the stress went down and he went to school. Well, turns out in hindsight, he probably had pancreatitis at the time, but his just manifested very differently from my other son. And it was very, very odd that we didn't know this until he was 17. But my other son would throw up, be in excruciating pain. And so we managed it with the tabs, with like a near infrared mat, just for heat and for anti-inflammatory stuff. And then just soothing things, other soothing things. And he didn't need pain medication. So
I assume you had to go to the hospital sometimes, though. You can't.
We were in the hospital twice. He's probably had about maybe 15 flares, I would say. And we had to go to the hospital twice in the very beginning, but then I had a developmental pediatrician that was working for me and we figured out protocols. So I don't recommend keeping your children out of the hospital, but I had access to medical doctors and the ability to kind of manage it at home.
Here's another question. How do we help ourselves in situations where something related to your illness and people and even healthcare providers aren't listening or don't believe you? It's so stressful.
It's so frustrating. I know, it's so frustrating. And I always carry tabs. My son, in fact, just had an MRCP, which is a form of MRI on his pancreas this week, in fact. And I, as a mom, it's just a stressful thing. I don't know what the outcome is going to be. Being in the hospital for me is stressful. Just kind of being reminded that my son has this in those moments, it's hard, right? So I just have them on. And if he gets stressed, because they said, oh, he had to get it wasn't an isotope, but they injected him with something before the MRI and he didn't know that he needed that because they didn't do that last time, right? So that kind of shock of like, oh, now I got to have a needle, right? So then he holds them, we lower the stress, and then he gets the needle, it's fine, and then we go on our merry way. So again, we're looking at this situation of a few hours of an appointment, knowing that there's going to be multiple things that are ticking up our stress switch. And when that happens, we're modulating it. We're bringing it down, and we can always bring it down with this to the level that we can then be reasonable and then recruit the breathing and the thinking and the coping strategies. But if we're flooded, they don't work. And so that's how I manage things like that.
How do you know, this is a good one, how do you know if it's real pain versus phantom pain?
Yeah,
I don't know if you can answer that.
Yeah, well, it is interesting. The way that, first of all pain is real, right? I think someone put in the chat earlier, when people say it's all in your head, it's like, okay, well, it is all in your head, but it's not that you're manufacturing it and making it up. All pain that you're feeling is real pain. You're really feeling this, but we can modulate that. So how you tell if it's phantom pain is if something that you do lowers your stress. Like if I put the tabs on, I know, oh, this isn't necessarily medical. However, it can be medical. You can be having a flare of pancreatitis and have the pain go from 7 to 3. So it's still medical, the cause of it. We're just modulating that pain switch, kind of like we're modulating the stress switch, right? Like your stress can get triggered. I can get some bad news, and that could put most people into like a stress switch of 8, let's say, but I can modulate it down to a 3. The bad news is still the bad news, right? The medical issue is still the medical issue. But the really important thing to know is you can have not a medical issue and still have pain if your body has adapted to that and your brain is kicking out pain signals. That's the phantom pain syndrome. But what we do is we just treat everything as though part of it is phantom pain. And then a lot of that goes away. So, what Patty was mentioning, thinking she was going to need those blocks her entire life. And then we treat things as though they're phantom pain and see how far we can get with it. And then maybe that's not as needed because a lot of our medical decisions are based on how much we're suffering.
Right.
Yeah.
We are running out of time. I'm going to sneak a couple more in here. And if we didn't get to your question, we will try to get to you afterwards. What advice do you have for a 17-year-old who's going off to college in the fall and has a SPINK1 mutation?
Oh, okay. Well, congratulations on getting into college, first of all. What an exciting time. I would say that college is fraught with a lot of probably temptations and a lot of things. So really getting that base of solid, healthy behaviors like the sleep and the diet and the exercise down and prioritizing those. And then really keeping your stress levels down with some of the things that we talked about would be really helpful. It's just such an exciting time. I think also there are, if I don't know how often you have flares, but there are resources and accommodations available with disability services at many at the colleges. So if you do have a flare, your professors can allow you to turn in assignments late, or if you miss a test or something like that because you're having a flare, there can be some accommodations. My oldest son is 17. He's going to college, not this next year, but the year after. And we are going to get him some accommodations. And then my other strategy is that we're not going to overload his schedule. That way, if something happens, he has some buffer. I'm not going to have him take like 18 credit hours a semester or anything like that. So just kind of lightening his load. That's what I would say. Yeah. So good luck.
Thank you. Thank you. I think that's all we have time for. Thank you so much, Amy, for sharing with us. Thank you, everybody, for being here. And now I just want to hand it over to my colleague, Olivia Serin, to wrap us up. Olivia?
Thank you, Megan, and thank you to everyone who joined us today. On behalf of the Mission Care team, I want to extend our sincere gratitude and appreciation to Dr. Serin for her time, effort, and support in making this webinar possible. And thank you to Patty for sharing her experience as well. It was a pleasure hearing from both of you. We post resources for our patient community as part of our patient education program. So please subscribe to our newsletter on our website and follow us on social media to learn more. Before you go, we'd love your feedback. There's a quick 1-minute survey. Your input helps us improve future webinars and make our resources helpful to you. You can also explore our past webinar recordings anytime on our website or YouTube channel. If you have any questions or comments, feel free to reach out. We'd love to hear from you. Thanks again, and we hope you enjoy the rest of your day.
Thank you, Olivia, and thank you everyone who joined us today live and those who are watching us from afar. Take care. Have a great day. Bye.